Ankamah recording EMG. EMG stands for electromyography, and there's two parts of the test. The first part is what we call nerve conduction studies, or some call it nerve conduction velocity. That's when you use the probe and you use the gel. Make sure you don't use lotion on your skin, because we use the leaves, the stickies. These stickies, if you use oil, baby oil, or any lotion on yourself, they will not stick. So we are done with the first part. That is, I call it stimulation, or some people call it shock. I don't like to use the word shock because it scares patients. So I say stimulation, and if you can go up or down, but the doctor or whoever does it has to be compassionate to make sure it's not causing you too much discomfort. Now that we are done, we are going to do the needle portion. That's the EMG portion of the test. And you see that I just took up a brand new needle. This is disposable. This is 50 millimeters. There's one for 75 millimeters. That's the length of the needle. So I don't need to use this unless the patient is of a larger body. So I'm going to use 50. I'm able to go through the skin and go to the muscles. A lot of patients dread this test, this portion of the test, because they say it's painful, but it all depends upon the doctor who is doing it. If the doctor is very caring, like me, and compassionate, you take your time, make sure the patient is relaxed, because if they are tense up, then before the needle gets to the muscle, the muscle already goes into spasms. Okay, so it's very important for you to relax. I cannot overemphasize this. And the doctor has to know which muscles are more painful than the others. So we've learned, most of us, all humans, the muscles as it comes closer, I'm doing the arm to the shoulder, has more muscle and more fat. All of us, no exception. But as you come to the fingers, you see the finger and the hand doesn't have a lot of muscle and fat. So over there it's painful, or it's more tender. But I bought this thing, it's called ether chloride. It's a cold spray that can numb and the skin, especially once I get to the fingers. So we are going to start. I have to put my leaves. I'll put one at the side. I'm going to start the first needle, and you have to put something we call ground. So green is ground. It's like electricity. There's ground, and then the needle serves as active, and the red stands for reference. Okay, so where the needle is going to go, I have to have the red. You see the color. So now that she's ready, I have to wipe the skin dry with alcohol. Make sure, because there's bacteria, good bacteria that lives on our bodies, on the skin. So wipe, because you don't want that bacteria to go into your blood. It can cause infection inside. It's good outside, but not inside the body. So I'm going to start. I'll put a needle there. I'll position my lead. Has to be a little closer. Then I'm going to hear some noise on the. Let's make sure we have everything. Okay, we are good to go. You're going to hear some noise. And we move the needle around. Why are we doing this? The purpose is to see if the patient has any pinched nerve in the neck. That's the purpose of the needle. Or if it's sciatica, that they have a pinched nerve in the lower back into the legs. Again, you have to move it gently. You have to be considerate. Okay, so I'm checking for C5, C6 nerve in the neck if it's pinched. I'll look on the screen and I listen to the voice, the noise. And then I have to examine. Sometimes you have to stop and then you go back and see, are you seeing anything? Is anything showing up? There's a special shape, and I see one shape here that shows a C5, C6 pinch nerve. There's no need for me to show you on the screen because it's more technical. It has to be a wave sitting there by itself. I have to save it in case the patient needs a copy of the waves. We have it. Sometimes we do this so that, yes, my patient is not going to go for operation, but sometimes the surgeon will send the patient to do this test to prepare them for surgery. Again, we are doing the upper extremities, EMG of bilateral upper extremities. So I just did one, and I think we are going to conclude the video. We want to thank our lovely patient for volunteering her time for this part of the test. But always I get that the test is extremely painful, extremely unbearable. In the last 15 years, I've had only one patient give up on the test, on the nerve test. The EMG portion, that's the needle portion of the test. So it has to be done in the right hands. Some technicians are doing it. Always ask who is doing the test. Is he a medical doctor or is he a technician? I'll prefer that a medical doctor does it and not a technician. Okay, this is the end. New Jersey Sports and Spine Medicine. We are located in Somerset, New Jersey, United States of America. Dr. Andrew Ankamah. Thank you so much for watching.